Hi, today we are going to discuss a APA report or APA Health Advisory for social media usage by adolescents. Now, APA is American Psychological Association, which is basically a professional organization of scientists, consultants with over 150,000 people involved in it. It is an organization which is 130-year-old, considered to be one of the professional organizations which takes care of human rights issues, mental health issues, issues of abortion, welfare detainees, rights of mentally ill patients. So they have found out that there are certain studies which are linking adolescents or teenagers' mental health because of social media issues. So their panel decided to issue a guidance or guidelines for the parents in America. Right now, 95% of American adolescent teenagers are on YouTube. 67% use TikTok, 62% are into Instagram, and around 57% is on Snapchat. This data has been taken from the Pew Research survey done for teenagers between age 13 and 17. So if these are the number, this much percentage of teenagers are on social media, hence it was important for them to come out with some advisory. The social media usage is something which is not good or bad, but it's actually case-to-case basis which has to be monitored, which has to be trained in order to ensure that the child develops in a more mature way than what he or she sees on the social media. Because each child develops at a different rate, hence the guidance, hence the training, hence the observation monitoring part needs to be individual centric. Hence they say that it is important to ensure that there is a training part involved in the social media usage, and the second part is of the monitoring of what are the activities of these adolescents. One of the APA scientists, Dr. Ryan Sultan, reported to one of the major dailies over there, and Dr. Ryan Sultan is a medical director of integrative psychiatry at Columbia University in New York. He says he has started seeing the first-hand experience of what is the negative impact on adolescents or on teenagers. Nearly every parent and teen he works with are struggling with how to manage social media, is what he reports. Youth should be encouraged to use social media as a way to promote healthy socialization, such as intimacy with the peers. That was his suggestion. Now, what are the impacts of unchecked social media usage? Unchecked social media usage can lead to worsening of self-image. It can lead to body shaming. It can lead to having a bad assumption about oneself, about how one looks in terms of whatever is the physical structure, or a comparison of physical structures. It also can lead in promoting bullying behaviors, because somebody who is smarter might think that okay, he is most smartest person on the planet or on the universe, so he starts taking it as an advantage and start using it as a means to bully others who are maybe black in USA or maybe fat in his group. It deprives youth of the sleep. Understandable, because the more time you spend on social media, the less time you have to do your normal activities, and sleeping is one such activity which can be reduced or constrained if you are gaining some happiness, if you are gaining some more thrill out of doing what you are doing. So it can adversely impact overall mental health. So basically it worsens your self-image, it reduces your sleep, it leads you to bullying behavior. Overall your mental health goes down, and hence you should be ensuring that there is a check on what social media usage. Now, advisory for children between 10 to 14 says that parents should be regularly checking in the social media usage of the children. They should be discussing on what the children are seeing with the children, so as to have a understanding of what is right for their age, what is not, what is inappropriate content for their group. It is important because as young teenager have not yet developed an idea of what is right, what is wrong, what is mature self-control, and hence they can be easily influenced by attention, feedback and reinforcement process, wherein you gain attention, then somebody gives you, okay, you are doing wonderful, and then in order to reinforce the idea, in order to gain the same thrill, in order to gain the same level of feeling, you again repeat it again and again, and you fall into the trap of being on the social media, doing something which is not advised, and that leads to many other health issues. APA advisory also suggests that usage by people who are below 13 years. Parents to put a limit on the usage of social media by teenagers, by these young kids, because as kids grow older, they get more idea of what are the risks of overusage, addiction and things like that. So teenagers' exposure to social media risky behaviors are one of the important factors to check out, because we are seeing there is a trend on social media to accept certain challenges, and those challenges are life-threatening many a times. Earlier also there have been cases of using a lighter and spray to create a makeshift blowtorch, wherein one of the celebrated footballer named Mason Dark was burned 75% when the spray exploded. Right now it will take at least six months of his time to be on the path of normalcy. So it all starts from as simple as trends, which can mean ice bucket challenge, which was 10 years back. Right now there are new forms of challenges which are very life threatening. So parents need to have these studies, these cases, before they make a decision on what is happening on social media. That's the small suggestion from APA. Teenagers' online presence or online exposure to hate and violence leads to mental illness or anxiety and depression. So mostly parents think about avoiding children to watch those violent activities on the public or wherever. But on social media, all of it is there, available, easily available. So unless and until it is controlled, it is going to be a reason of anxiety, mental problem in teenagers. Now adults need to watch out what is problematic behavior in social media. How do you know what are the signs of problematic behavior? If you find your kid unable to stop even when they want to, if you see your kids lying in order to continue using social media, if you see kids failing to keep up with daily activities or maybe physical activities or maybe their task or grades, all of it symbolizes that there has to be a break now. And social media should not interfere with teenagers' physical activities of sports, exercises or many other things. That is what APA suggests. APA also suggests to avoid online comparisons, because it creates a bad self-image in teenagers' mind. Studies have shown making comparisons on social media can have a detrimental effect on adolescents' mental health. To minimize this, APA recommends teenagers avoid social media for this purpose, wherein they are comparing how they look, how they feel, how they appear on social, especially for girls, females, on their looks and appearance. It can have a detrimental effect, and it leads to not only poor body image, it leads to disordered eating, depressive symptoms among girls. So it is very important to see online comparisons are not done. Parents, what is APA suggests? It says that parents need to help children pass through that troublesome period or that confusing period of what is to be seen, what is not to be seen, and also to let them know that whatever people share on social media, it is very carefully chosen, it is very carefully presented to give their best version of who they are in their actual life, so that there is a curation done before the final content comes out. Hence, that most of the adolescents, most of the teenagers perhaps don't understand this, and they feel that there is a problem or they are inferior to what is being shown online. Teenagers should be trained in social media literacy. That is one thing which they are saying, that they have to interact, they have to have a proper discussion on what is there on the social media and what is there in actual life, and how they differ. That discussion, that it is like as same as training for getting a driver's license, for training for driving a vehicle. Here also certain kind of training is expected to use social media. They suggest that parents need to check in periodically with their young ones on what they are doing, what they are checking on social media, and they need to be open about issues which their young ones come up, via topics on which the young ones come up. There has to be an environment of open communication channels, so that your child is not hesitant to discuss on any topic. The last impact is on impact of AI. As the time progresses, AI is coming on different platforms, be it Snapchat, be it WhatsApp, be it Facebook, Instagram. So everywhere we will be seeing the heavy usage of AI applications, and these companies mostly target youths because they know their mentality. Hence, it's important to see what is right, which are the tools which are appropriate for these kids. So hope you have got a fair idea of what are all the suggestions of APA for not only kids but also for the parents, to ensure that the social media life of their children doesn't impact their mental health of anxiety and depression. Thank you for your time and attention. Hope it has been useful.